Women who are pregnant and take acetaminophen for pain during pregnancy have a higher risk of having baby girls with language delays. Hey folks, it's Dr. Sam, and I want to talk to you about a study that was reported in the European Journal of Psychiatry. This was done in Sweden, and a group of pregnant women were studied who took Tylenol analgesics to reduce pain, and they found that these women had a higher risk of having baby girls who were diagnosed with language delays. There was also another study that was reported in JAMA Pediatrics. This was a study done in Denmark that pregnant women who took acetaminophen had a higher risk of having children diagnosed with ADHD. So in terms of reducing pain during pregnancy, my recommendation would be to look for natural remedies. And I'm going to list some here that pregnant moms could try instead of using the Tylenol analgesic perspective. Okay, here we go. Number one, I would recommend primrose oil in the evening. I would start off with a dose of about 500 milligrams, but you want to check with your doctor if you're taking medication for mental illness or you bleed easily. You must check with your doctor first to make sure that you can take primrose oil. Number two, I would recommend essential oils. And there are three of them that I use in a treatment to reduce pain: birch, followed by spruce, followed by lavender oil. So in using these three, they can actually help reduce pain and inflammation in the area where you're experiencing pain. Another technique I use is the essential oil peppermint, which is a cooling oil, followed by birch, which is a warming oil, and then using peppermint oil again, which is a cooling oil. This combination also can be effective at reducing pain and inflammation. Next, I would increase your magnesium levels. I would consider taking a warm Epsom salt bath if you're suffering pain, but be very careful in terms of the heat. Again, check with your doctor first. I would also recommend bone broth. This has a lot of great minerals and ingredients in it that could also reduce pain and inflammation. I would increase your probiotics and enzymes in case you have any kind of inflammatory response going on in your intestinal system. And finally, I would recommend getting some craniosacral therapy. I know in my training in craniosacral therapy, I worked on pregnant moms and I also worked on women near birth. And I found in both cases, craniosacral therapy was very effective in reducing pain and relaxing moms. And it's a natural way to help get rid of pain without using Tylenol and analgesics. So overall, my approach is more whole health, and in using these natural remedies, they're much more effective and they don't have the side effects of acetaminophen, which can cause developmental delays.